scene, didn't you?
What is with this tension?
Black Widow, stream sekarang di Disney Plus Hotstar. Dengan hanya RM7.50, naik taraf sekarang di saluran 200 dan nikmati Disney Plus Hotstar.
Good evening. You are tuning in to AWANI Tonight with me, Farhana Sheikh. Pfizer vaccine gets conditional approval for booster dose. And in conjunction with Breast Cancer Awareness Month, we discuss early prevention and treatment. That's coming up. The government has launched the Kelang Malaysia squad that will coordinate all the mechanisms of aid delivery around the country to ensure that no one is left behind. Prime Minister Datuk Seri Ismail Sabri Yaakob said the squad would be a collaboration of agencies under various ministries, the private sector as well as non-governmental organisations led by the Social Welfare Department under the Women, Family and Community Development Ministry.
Ismail Sabri said about 10,000 individuals are ready to be mobilized to every corner of the country to help those affected by the pandemic. This number is expected to increase when more ministries and agencies as well as volunteers register. The Kelang Malaysia concept, first coined in the Prime Minister's introductory speech on August 22nd, invites Malaysians to set aside their differences and come together to help realize the Shared Prosperity Vision 2030. The official launch of Kelang Malaysia is scheduled to take place on October 22nd in Kuching, Sarawak.
The Health Ministry has granted conditional approval for the Pfizer vaccine to be used as a booster shot at least 6 months after the second dose for those aged 18 and above. It is the first COVID-19 vaccine approved as a booster dose in the country.
Health Director General Tan Sri Dr. Nur Hisham Abdullah said the matter was decided during the 365th Drug Control Authority meeting today. The Comirnaty vaccine was earlier approved for conditional registration on June 15th for individuals aged 12 and above. Dr. Nur Hisham said the approval required information on the quality, safety and effectiveness of the vaccine to be monitored and evaluated from time to time to ensure that the benefit outweighs the risk.
The new wholesale and retail ceiling price for the COVID-19 self-test kits will be issued next month. Domestic Trade and Consumer Affairs Minister Datuk Seri Alexander Nanta Linggi said the ministry will ensure reasonable price as well as adequate and continuous supply of the product to further incentivize the public to get self-tested.
According to Nanta, there are about 6 million COVID-19 antigen rapid test kits already in the market. He said the ministry was also in discussions with the Health Ministry to enable more premises like supermarket to sell the test kits. This is expected to be implemented by the end of this month. Starting September 5th, the maximum retail price for the COVID-19 antigen rapid test kit is RM19.90 per set, while the wholesale price was set at RM16 per set. Yesterday, Health Minister Kari Jamaluddin said the ceiling price of the product would be lowered as an incentive for the public to make their own checks when interstate travel is allowed.
Are pregnant women at higher risk from COVID-19? Is vaccination safe for them? Will the vaccine affect the fetus? These are some of the concerns pregnant mothers have, which attributed to their hesitancy to get vaccinated. As the government pushed for vaccination among the group, fertility specialist Dr. Sumitra David Valyapan addresses some of the concerns involving pregnancy and COVID-19 vaccines.
Pregnant women are susceptible to COVID-19 infection throughout their pregnancy, but especially so in their late second trimester and their third trimesters of pregnancy. They have a higher risk of needing hospital admission, getting admitted to ICU, needing ventilatory support or breathing support. They also have a higher risk of needing to terminate their pregnancies prematurely.
Malaysia has reported 144 COVID-19 deaths among pregnant women as of September 14th, with records showing that none are fully vaccinated.
News that maybe vaccination might actually cause miscarriages or cause abnormal development of their fetuses or cause stillbirths. However, this has all been debunked, and what we actually know, the data actually shows that pregnant women who have not been vaccinated but get the COVID-19 disease are the ones who are actually at higher risk of having miscarriages or abnormal fetal growths or stillbirths in pregnancy.
Dr. Shumitra emphasized the role of healthcare personnel in advocating for vaccination among pregnant women and the importance of unbiased, accurate, and up-to-date information on COVID-19 vaccines.
Now, in Malaysia, every pregnant woman has easy access to healthcare and a trusted source, namely in the form of a doctor or a midwife, be this in the private or the government setting. And these healthcare personnel are the best advocates, and they should be able to provide our pregnant women with accurate, unbiased, and most importantly, the most up-to-date data or information on COVID-19 and its vaccination. We need to empower our mothers with the information, with the correct information that COVID-19 vaccination is the best way to protect themselves, their babies, and their families. We also need to emphasize the fact that contracting COVID-19 is much more dangerous than any side effects that getting the COVID-19 vaccination that they may worry about. Studies have also shown that mothers who are vaccinated with the COVID-19 vaccines may pass on some antibodies, which is protective to their newborn through the placenta as well as through their breast milk.
More Malaysians are diagnosed with cancer more than ever before. Even with more awareness being made around cancer, the number of cases detected at advanced stages has also risen. In conjunction with Breast Cancer Awareness Month, we speak to consultant medical oncologist Dr. Azura Rozila Ahmad on early prevention in improving survival rate.
Narrowing in on breast cancer, based on data from 2012 to 2016, almost 48% cases were diagnosed at late stage, rising from 43% in the 5 years prior. Dr. Azura says cancer patients can have a high survival rate if detected early. Hence, updated data on high-risk groups are crucial so that outreach programs on early detection can be carried out more effectively.
It really incorporates a system where we could have early detection. So we need to identify who are at risk groups so that we could target those people. So I mean, obviously we can go by age for that. The next thing is the diagnosis. We need to have a system to ensure that if there is a concern, there is a process to ensure that we can diagnose it quickly, a timely diagnosis. And when we deliver the care, it has to be a quality care that is affordable, and to reduce fair treatment for everyone.
Dr. Azura says it is time for Malaysia to commit to implementing a more effective cancer control plan that emphasizes on equitable access to screening and treatment, as well as increasing investments into innovative cancer treatment research and technology.
High-income countries, they spend a lot of money, and they have they incorporate innovative treatments, and we know that innovative treatments with better surgery or better drugs and so on has actually improved their outcome. And if you actually see the statistics in the West or in high-income countries, the 5-year survival is reaching 90% for breast cancer. Whereas in Malaysia at the moment, I mean, whatever data we have, we're about 66%. So, I mean, it is a population, it is, you would question where we got the data from, but we know in our heart that we need to do more. We have to embrace innovation, but of course, it is at a cost, and I don't think any health system could sustain, especially ours, who is, recovering after COVID-19 pandemic. We need to find a way of sustainable, affordable healthcare to ensure that our population is well looked after.
We'll take a short break. Stay with us.
Ingin jual dan beli kereta dengan mudah secara atas talian? Tak perlu risau tentang dokumen atau ke bank. Custom akan menguruskan dan boleh menghantar di mana jua anda berada. Senang je, layari custom.my. Custom je lah.
When the world was changing for photographic film, we helped change the world as a pioneer of the digital age. In healthcare, we're expanding what's possible with advanced technology. But why stop there, when we can focus our AI and IoT expertise on business innovation, helping tackle some of the toughest challenges in the workplace? When it comes to innovating for a healthier world and a more sustainable society, we'll never stop. Fujifilm, value from innovation.
Sinaran UV merosakkan kulit siang dan malam. Clinel Whiten Up Night Cream, teknologi anti penuaan foto, mengubah UV berbahaya demi mencerahkan kulit. Kulit lebih gebu, anjal dan cerah. Cerah berseri bermula dari dalam wajah. Clinel Whiten Up.
Welcome back. Schools across the country have started reopening in phases starting October 3rd. According to the National Union of Teaching Professions, Vel Mohan Rangasamy, teachers are now ready to further improve physical lessons by taking advantage of the online world.
We can see that now many teachers they have to come up with this new technique of teaching, which they were not actually trained for that, So, but when they are put into this kind of situation, they have to learn, and many teachers, my friends, my colleagues, I myself, we have to learn from somewhere, from the Google and all that. So various kind of technique that we learn from this method, and we try to implement that kind of a new method. So what we can do in future, we can make it presently, earlier, when we were teaching, the teachers will take the student to the computer lab. But now I think if we have a projector in every classes in the school, probably the teacher can continue with this kind of new method. So we teachers have done already learn how to use a lot of online method, and then Google Meet and all that. So they can continuously try to apply this, like the other country, they already a little bit advanced.
He said that disruption of the education system following the COVID-19 pandemic calls for more efforts to help teachers and educators to be up to date.
This is something very new in the education system for all the teachers. Probably the government can, the education department can start giving teachers exposure to this kind of new methods of teaching through online and all that, so that in future we can implement this kind of teaching when it is necessary, and to make the education more interesting.
Journalists Maria Ressa of the Philippines and Dmitry Muratov of Russia were awarded this year's Nobel Peace Prize. This is for their efforts on safeguarding freedom of expression in both countries. The prize-giving committee described free speech as under threat around the world. Both journalists have faced attempts by their respective governments to silence their publications. Ressa is founder, CEO and executive editor of Rappler online news portal, closely covering President Rodrigo Duterte's regime, while Muratov is editor-in-chief of Russian newspaper Novaya Gazeta, which publishes critical coverage of the Kremlin. Singapore will expand its quarantine-free travel program to include South Korea and the US beginning November 15th. Under the vaccinated travel lanes, those fully vaccinated can enter Changi Airport with a negative COVID-19 PCR result instead of quarantine.
Singapore tested a similar program for visitors from Germany and Brunei last month. Its government said after the success of the pilot program, they are working on a VTL with the US as soon as before the year end. Singapore plans to carefully reopen international borders amid high number of daily infections, with the Republic reporting 3,577 new cases today.
Tonight on Consider This, we speak to Simpang Renggam MP Dr. Mazli Malik, who recently published his account of the 20 months he was Education Minister and the lessons learned about the process of implementing education reform and the challenges that came with it. That is all we have for you on AWANI tonight. Get the latest news update on COVID-19 and COVID-19 vaccines from astroawani.com and the Astro AWANI app. I'm Farhana Sheikh. Thank you for watching.